Yay.
Yeah.
Yay.
Hi.
Yay. Hey, everybody. I am so excited. I've got to look at my date again. It is Friday, April 10th, 1:00 p.m. I am Leslie Bennett here, keeping it simple, keeping it real in Thomasville, Georgia. And I have with me today Patrice Bullock. Everybody say hello to Patrice. And before we get into everything, I would love for you guys to be interactive. So the other day, if y'all watched my interview with 𝘆𝗲𝗿𝗀, we kind of lost audio, and it was because you guys let me know that we were able to, end that and start a new broadcast. So, but you can ask questions during this or just make comments. We love it when we get interaction from you guys. So, well, we're going to move on into it. So first of all, Patrice, let me introduce you to Patrice.
Okay.
Patrice is a board certified family nurse practitioner with over 40 years of experience in the medical field, 15 of those as a family nurse practitioner. Her practice, New Genesis Center for Functional Medicine, has been in operation in Thomasville for 12 years. So Patrice, can we just start off with the question, why functional medicine?
Why functional medicine for me, or what is functional medicine?
Well, let's start there. That's a better place. What is functional medicine?
Yeah.
I told Doug I was going to try to read my questions today.
Okay.
So what is functional medicine, and is it any different than traditional medicine?
Okay, so let's just think. Most of us are very familiar with traditional medicine. Conventional medicine, you get a sore throat, you run a fever, you go to the doctor, and you see the doctor, and you go home with a prescription, and in a few days after taking that prescription, you're better.
Right.
It works great. All people, all practitioners who practice functional medicine, nurses, doctors, PAs, other healthcare professionals, we've all been trained in traditional medicine. That's the basis of our training. Functional medicine are those same practitioners who have gone on for additional training, specifically in functional medicine. And this is why. Functional medicine, for those of us who practice it, has usually become very important due to the fact that for one reason or another, conventional medicine or traditional medicine, we've seen the limitations of it.
Mm-hmm.
And the strong suit and the reason we go back for additional education in functional medicine is because functional medicine looks at what's actually causing the problem.
Sure.
Why has a person, let's take arthritis, for example, very common, but still not normal, even though it's extremely common, whether you're younger or older. And so what we do in functional medicine is we're looking at what's causing the pain.
Mm-hmm.
Why are you having pain in your left knee? And so from a functional medicine standpoint, we know from our training that there's a higher level of inflammation in that joint, or maybe several joints. And so where our job is to focus our therapies on the inflammation, to reduce the inflammation, to eliminate the inflammation, and make the pain go away.
Right.
Without a medication.
Yeah, that's what I was about to say, without a medication.
Right. So the therapies that we use, just to finish that thought, are usually more food related, because there's much that we do to our bodies from a food standpoint that actually raises the level of inflammation in our body. So if we change our food, if we make some other targeted changes, we can actually eliminate the pain. No drugs, no side effects, no pain.
So so a person comes to you, how do you diagnose them? Obviously, you know if you have arthritis or not, but they're coming to you, how do you diagnose whatever it is, and how do you know what direction to go?
In the same way that we do in conventional medicine, we are trained in our diagnostic techniques insofar as, so what's going on with the joint? We examine, we take a good extensive history, we look at all the factors that are contributing, and then we can diagnose from that standpoint.
Sure.
In the same way that we would in a traditional setting, except that our tools are different. Instead of writing a prescription for for, let's just say arthritis, for high dose Advil, Motrin, ibuprofen, or whatever instead of doing that, we actually don't prescribe a drug. We actually prescribe those things, and they can be food, often food, and sometimes there are supplements that can be helpful, but the most powerful part of it is our food and our digestive tract too.
Right. So, I bet sugar is eliminated in a lot of those cases. Huh?
Sugar is one of the strongest inflammatory foods. There are others, but food, sugar is so prevalent these days, and it's so damaging, and it's hard too because sugar is addictive.
Yeah.
And but we can help with that. I can help people get off sugar and help with the cravings, etc. So
well, so let's talk a little bit about where we are with COVID-19. Obviously, that is at the forefront of all of our minds right now.
Yeah, right.
And there's a lot of fear that we're going to either get it, and if we get it, how it's going to affect us or one of our loved ones. So how do we make sure, or can this be avoided? How do we make sure that we avoid it? And I know that has a lot to do with our immune system. So how do we keep our immune system in the best shape possible?
Yeah. So first things first, follow all the guidelines.
Yeah.
Be smart, follow all the guidelines. There's no way around that. Number two, instead of just kind of hiding and avoiding the virus, which we must do, we've also got to take the time to say, what can I do? How can I be proactive at improving, increasing, strengthening my immune system? So that's what we do. We focus on what we have control over. Right. And so what that would be, it does go back to your food. Just think about it for a second. How many times, if food is information, how many times do you put that information in your body? A day.
For me, too many times a day.
Well, it can be 100 times, and it's all good. But the kind of information that goes in, Leslie, it's very much often equated to software. Yeah. If food is information, it's like software being downloaded to your body. Right. And with that information, the body is then operates according to that information. Just like if you download bad software to a computer, what happens? The operation of the computer is bad. Well, the operation is poor, and you got problems, and it's really exactly the same in our bodies. Food is information, and we download a lot of information every day. And if we choose really good, strong information, man, it makes a huge difference in the outcome. The outcome is feeling good, having more energy, less pain, brighter mind, sharper mind. So if we think about food as information, it's great stuff. We can make really good proactive choices. And you asked about the immune system. So the same foods that I was referring to in the arthritis inflammatory situation very much also strengthens our immune system, or suppresses our immune system, or creates havoc in our immune system. It creates instability. Yeah. And so we do the same things. Let's focus on what we can control, and that is what goes into our body and instructs it in how to operate. So we focus on improving the immune system. That's what we need to do. And that's kind of the bottom line. I can tell you more if you want.
So could I have a low immune system and not be aware of it?
Absolutely. Absolutely. And, the paradigm today of good health means I just don't have a disease.
Right.
But in fact, being healthy is so much more than just not having the disease. Once we get a disease, we're kind of like way behind the 8-ball. And so being healthy is about being proactive, making good choices to instruct our body in how to perform. And a lot of that, it is certainly always about food, but there are other other things as well. Just during this period of time of COVID-19, there's an incredible amount of fear.
Yeah.
And that fear is information that influences our body. Yeah. And it's very normal, so normal. Normal to have fear and increased anxiety. And, that's just very normal in this situation.
Right.
But controlling everything that we can do to protect ourselves from that information on a constant basis, so important.
Mm-hmm.
Are we keeping the news on 24/7? Are we watching it too much? Are we, it's not just about the news. Another heavy influence in this day and time is social media. Mm-hmm. Social media can be very positive. Mm-hmm. And helpful insofar as communication and connecting people, but it can also be very fear promoting, very anxiety promoting. So that's another measure that we have control of.
So what you're saying then mm-hmm. is that there is a connection between our emotional and our physical health.
Well, yeah, we don't think about it too much these days, but in a very basic sense, high stress, anxiety. If you know anybody who has anxiety, they know exactly how that feels in their body. It causes, when it causes increased heart rate, increased blood pressure. These are emotions that are being transferred to the body, the physiology of the body. So if fear and stress can cause your heart to beat faster, your blood pressure to go up, your chest to feel tight, your stomach to hurt, these are all the connections that we're a little more familiar with insofar as emotions translating into physiology. And yes, absolutely. I think we've all heard in years past, somebody's under a lot of stress can get ulcers. Stress has a lot to do with the digestive tract as well. So, there's absolutely a strong, strong connection. So as much as we can do to protect ourselves, we're going to be, our immune system is going to be stronger. Our day-to-day peace and happiness are going to be much, much improved if we protect ourselves. It's good to be informed. It's good and wise to be informed, but to relive coronavirus 24/7 has a very detrimental impact on our brain, our body, our every system.
Yeah. Well, so we talked about that's our emotional health. So what ways? I think that you kind of just hit on that, but mm-hmm. What is the best way to stay emotionally and physical healthy? Hang on one second. Katie Bill, could you shut that down, okay? Because you're messing up my video. Just turn it off. Okay. Katie Bill was playing games, and Doug was telling me my video quality was poor. So again, before we go, I want you to just really kind of nail that down on the best way that we can stay emotionally and physically healthy while we're under this mandated shelter in place.
Yeah. So we've talked about a little bit about what we need to avoid. From a continual exposure to social media, continual exposure to anything that's fear producing, like the news. We can touch base, but then we need to move on. So what do we do instead? We're stuck at home, and what are we going to do but watch television? Well, there's a heck of a lot we can do. We can listen to music. My gosh, music is so healing, so de-stressing, and so refreshing and renewing, and singing. And it may sound a little silly, but heck, nobody's at home but you or your family.
Well, I can tell you an example of that. When I get home every night, usually on a daily basis, my husband turns on music around dinner time, and I can tell you that the entire atmosphere of the house changes. Everybody,
totally.
kids are there, they're happier because I'm singing.
Yeah.
So I could totally see that being.
Yeah, absolutely. Yeah. So you know that helps you bring in more of it. Bring in more of it. Maybe in the morning when you get up and instead of flipping on the news or the TV, turn on some music. Yeah. You know, in the evening, light a candle. That doesn't cost anything, right? You know, except your little candle. But you know, everything that you enjoy doing, reading, whatever it is that you love, connecting with family. That's been one thing that I've been incredibly aware of, is my desire to, I mean, I've got great family, but you know, I don't necessarily talk to them enough, you know, but we've been FaceTiming with more family, or just calling them on the phone and talking and chatting and checking on them. The other things that you can do, dancing. You know, it may bring a horrible thought to mind, but you know, but dancing, oh my goodness, it just, the movement, and it's part music and it's part moving, and moving that stress through and out of your body is so incredibly important. Moving's important. Some of the other things that we can do to stay healthy is number two, after music and moving, I would say stay hydrated. Yeah. Lots and lots of water. Reduce your caffeine. I think it's sort of natural when things like this happen. It's almost like we up our, that's okay. We up our caffeine intake, but up your water intake. And there's another reason for that. This system here, upper airway system, nose, mouth, this is where viruses enter the body. If this is dehydrated and cracked and underhydrated, you're at increased risk for contracting a cold or any virus. Yeah. Okay. Water. Keep your body really well hydrated. The foods that do suppress our immune system, and I'll tell you very quickly, are sugar-based foods. They research proven suppress your immune system. Sure. White flour also acts a lot like sugar in the system, very, very similar. Too much of other inflammatory foods. I love cheese, but I have to keep it down to lower, because it's an inflammatory food, but it also increases the inflammation in this area, and it increases mucus production, which puts us at increased risk of contracting whatever's in the air. Yeah.
Is that all cheese, Patrice? Is that all, any kind of cheese, period?
Anything from a cow.
So it's dairy?
Dairy.
Okay.
Now it's not the time to be drinking a whole lot of milk.
Yeah.
Switch over to almond milk. It's really a great switch. But yes, those are some very simple things that you can get out of your diet and work on those things. Increase your vegetables. What I like to call category 1 vegetables, your greens and reds and yellows, and all of your wonderful vegetables that Mom always said eat more of, and that you grew in your garden. Those you really want to increase. Work on the nutrition in your life and in your family. You've got time to cook. More of us have time to cook. Apparently, those are not the foods that are not in the grocery store. Yeah. It's the Cheetos and the pizzas that are off the shelf, but the vegetables are there. Yeah. Even frozen vegetables are really terrific foods. So bring in more of those for you and your family.
Basically anything that could spoil. Right?
Yeah. Well, I guess so. Yeah, you could say that. It's fresh, but I'll tell you, sometimes people think vegetables have to be fresh. Frozen in this day and time is very, very fresh and very helpful. It's not like it used to be, where it was maybe weeks or many days before you got your vegetables to market. Or frozen, the frozen foods can be very, very helpful because they're typically flash frozen in the field of harvest. Yeah. So the nutrition stays really well intact in the frozen vegetables. So if you're not doing fresh, do the frozen. That's fine, because they can go bad. You know, they're not going to go bad. And that way, if you've got them in your freezer, you've always got them. So staying hydrated, getting rid of those inflammatory, unhealthy foods. what would be the surprise if through this COVID and social isolating that we would get healthier rather than, be unhealthy. So, we've got time to do it. Let's focus on that. Some other things, make sure you're getting sleep. I tell you, sleep for many years, I think it's been sort of sidelined as optional. We can, it's almost like we would brag about how few hours we need.
Yeah.
It's nothing to brag about. We've got too much research this day and time that implicates not enough sleep increasing our risk of disease and poor quality of life and just making us feel bad.
Yeah.
Who wants to feel bad?
Yeah, no problem with me. I'm in bed by 9 o'clock every night.
That's good. Good. A couple of other simple, easy, no-cost things are if you are having some trouble with anxiety and stress, hopefully you've got a bathtub. Fill up your bathtub, throw a cup of Epsom salts in there, and that's almost as good as a drug for relaxing a person. That can be so very helpful at relaxing. And get out of the sun. Sun is very immune system boosting. You just don't get out there and bake yourself, but just get out, and it makes you happier.
That's vitamin D, right?
It's vitamin D, but there's many other
benefits,
neurotransmitters that are stimulated in the presence of the sun. Again, watch your exposure. Don't have too much. So, and get outside and just move, just like you'd move inside to music or, but use really, my point is be proactive. It has been normal to be very afraid and our anxiety level to go up. But at this time, let's move forward. Yeah. Let's control what we can. Let's empower ourselves and our families to take control of our environment that we're in, and let's do this. There's a lot we can do in being proactive, and so far as our immune system is concerned. You don't have to be in a gym to exercise. There's so many videos online for any kind of exercise. So yeah.
Doug's down at the bottom of my screen flexing his muscles. So
good.
He had a question. So a while ago you were talking about the dryness in the nasal passages when you were talking about getting more water and just staying hydrated.
Yeah.
He asked, is that why it's easier to get sick in the winter because of dry air and a dried out nose? Does that have a correlation? It
can be a factor. Because of we're in and out of the cold and the heat and cold and heat, and that actually can dry out the mucous membranes.
Yeah.
But it's also just kind of the stress of the expansion and contraction on the lining of both the throat, and we breathe that air down into our lungs. And again, this is the area of concern at this time, are the lungs and our immune system. The other thing is that during the wintertime, beginning at about October, Halloween, through Thanksgiving, through Christmas, and then we end up in January with quote unquote flu season.
Yeah.
But over October, November, December, we've done a lot of hitting our immune system with a lot of sugar.
And exhaustion, and we're so busy. So we're not sleeping as much.
Stressed. Yeah. Wow. So all of those factors together, created. It's kind of the result of our choices.
Right.
But we can be, my goal is to be here to remind us what kind of control we have over our health.
Yeah.
And that to know that those choices have impact on your health and your resilience. Not only that, you just feel better. I mean, if it decreases pain, my God, through making our choices with better food and decreasing our stress, moving, listening to music, taking a good Epsom salts bath. Those are things that we do have control over. There are other deeper, more complex things that I deal with here in the office with patients, but those are the first things. So it's great to know we've got that control.
Right. Well, this is a lot of great information, and you know, so much of it, like the water, of course, we hear that, and it's so, and moving around, it's such common sense. But for you to, I love the way today that you connected those things with our immune system and our avoiding, not just staying healthy, but avoiding and getting in front of something so that we don't get sick. And then how much our emotional health really plays into all that. And what I love about you, Patrice, is how positive you are. Always so positive. So if during this time or after, I guess when I say during this time, I mean quarantine, and then after, I mean, if they want, I mean, what are if somebody's at home and they're wondering if maybe they should come see you for a visit, what would you say to them, and how do you want to get things started?
So what I'm doing right now, and I've always done some of this, but what I'm doing is I'm seeing my patients by Zoom or by phone. It works very well. I actually have people complete the same history forms and that sort of thing. And we go by that. I'm not able to do a physical exam, but in this telehealth day and time, you know, it's not altogether necessary. And so what I'm doing is I'm seeing most patients by Zoom, phone, and they can call the office and make an appointment. I offer anybody, because it's a little different approach to medicine and healthcare, I offer anybody and everybody a 10-minute complimentary phone consult so that they can ask questions. If they, you know, have a specific concern, I can tell them what it looks like and what the approach looks like and what we can do. So just call the office. Trish is my office manager, my awesome office manager, and she will answer questions and get you scheduled. And so we can get started right away. You know, I wrote down something the other day after I had been talking to somebody, and they were talking about how disempowering this COVID virus has been. But, you know, I say, you know, let's don't take this lying down. Let's get up and let's move forward, and let's do everything that we can do, and we can do a lot. So let's get up and let's move forward and do everything we can do, and just take the bull by the horns and move forward.
Awesome. Well, we've got Leslie's asking for your phone number, so we'll put all of that, Leslie, and for those of you who are interested, I'll put all of Patrice's contacts in the post. And ask questions. I mean, if y'all want to ask questions, I've tagged Patrice in here, and she can answer them if you've got any. But thank you so much for being with us today.
And Leslie, you and Doug, I really appreciate y'all both for using this platform. It's, you know, it's great for everybody and supportive of the community. And, you know, let's again, like I said, take the bull by the horns and move forward. Don't take this laying down.
That's right. Well, and I always try to stay positive, and I love being around positive people. That's great. So, all right. Well, we're about to go, but on Monday, oh my goodness, who are we having Monday? I cannot even remember. I'll post it in the comments. I've actually got people scheduled all the way for the next couple of weeks. So we've got some really good topics coming up. But for those of you that have any questions for Patrice, make sure you put them in the comments. I will put her contact information in there. And thank you guys so much for watching. Thank you again, Patrice. Y'all have a great weekend and happy Good Friday.
All
right. See you later, guys. Bye-bye.
Thank you.